1,200 federal workers in Richmond sent home today from work after their building is shut down. Now, County Health Department confirming Legionnaires' disease has in fact infected that building. It is the Social Security Administration building, and it's apparently going to stay closed for some time.
And it was just minutes ago that we got the word that it is Legionnaires' disease. Let's go to Tom DeVries for the latest on this story. Tom?
There have been 12 cases of pneumonia in this building behind me in Richmond, the regional headquarters of the Social Security Administration. 12 cases in just a few months, one of them fatal. Late this afternoon, Merritt Hospital, after a preliminary autopsy, did confirm that the woman died Monday night of Legionella type 1, which is Legionnaires' disease. The building was closed at 1:30 today. The building, at the time it was closed, officials did not admit that there was any particular health problem. I don't believe at that time they knew there was a health problem, but the employees, even then, were suspicious. And in fact, the closing, as far as they're concerned, came not a moment too soon.
Scary. When I found out about it yesterday, it was scary to me. I didn't want to come to work today, but I came on anyway. It's scary.
One woman said she's already sick.
Well, I do have bronchitis still.
But government officials, in announcing that they were closing the building, said they still don't have the conclusive facts.
The public health people, and we do have somebody here who will be willing to answer questions, have indicated that there's no basis at this point for making a decision to do anything because we haven't gathered the kind of facts you need to determine that, in fact, there's a problem with the building.
Dr. Francie Wise of Contra Costa County Public Health.
No, at this point, we're still gathering a lot of facts and confirming some things. We have several employees who reported a respiratory illness, and we're trying to determine what the cause of that was.
If all this is true, then why were the employees sent home at all?
We're concerned that employees feel comfortable about the environment they work in and that we be comfortable about it. So we want to do everything we can over a 72-hour period to make sure that we can assure them that things are okay.
This is a fast-moving story. When those officials were talking, they did not yet have the results of the preliminary autopsy. They did not know yet that the first fatal here was a woman with Legionnaires' disease. This now may change the situation here dramatically. The building was due to be closed at least until Monday. This could change the situation quite substantially. Legionnaires' disease we've all heard of. In July 1976, 34 people died after an American Legion convention in Philadelphia, in which apparently the ventilating system of a hotel was infected. On the other hand, Center for Disease Control officials in Atlanta tell us today that Legionnaires' disease is relatively common. There may be as many as 150,000 cases of Legionnaires' disease every year, very few of them fatal. In fact, only 15 to 20% of 1,300 confirmed cases were fatal. So we're talking about really a matter of 200 to 300 total fatal cases in the United States in the course of a single year. One of them apparently here this week. The woman is a 37-year-old janitor in this building. She died in Merritt Hospital on Monday night. Evan?
All right, Tom, thank you very much. And just to give you folks at home a little background on Legionnaires' disease, it is a form of a pneumonia that is caused by strains of the Legionella bacteria. And they say it's frequently found in water in small amounts without a known disease association. And research suggests that the disease follows the inhalation of heavily contaminated water droplets. And scientists have suspected that the bacteria could be transmitted through shower use. But most outbreaks, they say, have been traced to the air conditioning systems in large public buildings. So that's what we know so far.